So on to the next segment. Now, collaboration is the key thrust of our Temasek Shophouse Conversations. And we believe in the power of multi-sector collaboration and action to galvanize the community. With that, I'd like to invite Mr. Richard Magnus, Deputy Chairman, Temasek Foundation, to share details of our latest calls to action.
Thank you, Jennifer. I have learned so much today, and I must really thank our panelists and everyone who have taken time to attend this conversation. Now, collaboration and action are central to our Temasek Shophouse Conversations. They form the backbone of our calls to action, where we hope to galvanize our community. Temasek Foundation and KK Women's and Children's Hospital are committed to supporting mothers and their babies in the first 1,000 days. We have identified 2 priority areas for action: babies' nutrition and evidence-based learning programs. Now, good nutrition is critical to a child's development. In the early years, the mother's milk is the most nutritious, but not all mothers are able to breastfeed. That is why Temasek Foundation partnered with KKH to set up Singapore's first human milk bank in 2017. Since then, the bank has helped more than 2,000 babies. This is possible because of the generous donation of more than 10,000 liters of milk from close to 800 mothers. During the COVID-19 pandemic, the milk bank also successfully maintained a healthy 2-month reserve of pasteurized human milk at all times. This even as milk banks in other countries experience a sharp decline in donations. Now, the milk bank has done well. It has won 3 significant awards over the last couple of years.
My baby girl, Shafana, was feeble. She was born 3 months early. To survive, she needed all the nutrients she could get. But 2 weeks after delivery, I couldn't even express enough milk for 1 feed.
As a mother, I've experienced how upsetting it was to not be able to produce enough milk for my child, Talia. Breast milk is especially important for premature babies. Their underdeveloped bodies digest breast milk better than formula milk.
I tried many ways to increase my milk supply. None worked. I was in despair, but the milk bank gave me hope.
My milk supply eventually caught up. I even had excess milk stored at Talia's ward, so I decided to donate them to the milk bank. I took the necessary blood tests to ensure I was an eligible donor.
Many people around me were skeptical about us accepting milk from the milk bank. But I've already learned from Muiz that it was not against our faith to do so. I wanted the best for Shafana, so I went for it.
Today, Talia is a playful 1-year-old. She was once a recipient of donated breast milk too. I choose to share my milk so that no child will be deprived of this gift that gives life.
I will never know who our donors were, but their generosity really touched our lives and will go a long way in helping other babies in need.
Joining us is Professor Alexia. CEO of KKH, and Associate Professor Chua, who heads the Milk Bank. So Alex, as people become more aware of the benefits of breast milk, the demand for donor milk will surely grow. How has the Milk Bank scaled up to meet these needs?
Thank you, Mr. Magnus, and thank you all for joining us. Breast milk is the best nutrition for babies, literally life-saving for the sick and the premature ones. The good news is that the amount of breast milk from generous and warm-hearted donors has increased, even during the circuit breaker last year. We were able to help 2,000 babies last year and able to maintain a solid 2 months reserve of milk. And thanks to Dr. Chua and the team, what really helped was the measures such as providing our donors, caregivers, and recipients about how safe the milk bank is, and as well as providing, a dedicated courier service to facilitate the collection from donors as well as delivery and distribution of milk to the recipients, to the community. And looking ahead, we hope to expand the program to the community.
Alex, we appreciate your team's incredible work to help fragile babies and their mothers. Now, I know that even in times of emergency, the team overcame the challenges with innovative solutions. Chien, good to have you. It's been a long time since my children were babies, but I was deeply, deeply moved when I saw the looks of relief and joy on the faces of the mothers whose babies receive life-saving donor milk. How can the audience help promote breastfeeding?
Thank you, Mr. Magnus. Breastfeeding provides the necessary nutrients for growth and building immunity. It also promotes bonding between the mother and the baby. It is no wonder that the World Health Organization, the American Academy of Pediatrics, and the Singapore Health Promotion Board all recommend exclusive breastfeeding for the first 6 months. However, breastfeeding is an acquired skill. That is why we should all support and encourage mothers in their endeavor to breastfeed. So for our first call to action, we would like to invite the audience to pledge to support mothers to breastfeed exclusively for the first 6 months.
What about mothers who are unable to breastfeed? How can the Milk Bank help?
Some mothers may face difficulty in establishing their own milk supply, especially if they deliver prematurely or if they are medically unwell. And sometimes even healthy mothers may not be able to provide enough breast milk for their own babies. Those who are interested to find out how they can be recipients of the Donor Milk Bank, they can indicate their interest in the call to action, and more information will be sent to them. We also invite healthy mothers to donate their extra breast milk to the bank. Their contributions will definitely make a very positive impact on the health of babies who are in need.
Thank you, Alex and Chien. I'm sure many here today would step up to support the Milk Bank and promote breastfeeding. And now we come to Temasek Foundation's second call to action. As we have learned in the discussions, parents are the first and most important caregivers of their children. Parenting is certainly a continuous learning, full of trials and errors. But when there is community support, the journey is more effective and enjoyable. Temasek Foundation has developed a program called ParentWise. With Seed Foundation as our partner, we have curated evidence-based learning programs and resources that parents would need to support their children.
Meet Kevin, Rauda, and Punkil. What do they have in common? They're all parents. Parenting, for the most part, is often described as
a joy,
with many parents saying they typically feel
it's rewarding.
But there's another side of parenting, a side not often talked about.
I guess you could call it parental burnout.
Parental burnout is experienced when the demands of parenting exceed the coping resources that a parent believes they have available. This can lead to feelings of isolation and resentment.
Parenting is a big step that involves a lot of commitment, and that can be overwhelming for new parents.
This is Dr. Shefali Shore, assistant professor at the Alice Lee Center for Nursing Studies.
Part of the problem was not wanting to let others know how much I was struggling.
Research shows that parents with the support of one or two close friends or family members coped better with the challenges of bringing up their children than those without any support.
An important reminder to parents is that self-care is important. When parents are taken care of, they are better equipped and able to focus on raising their children.
Having the support of others is great because you feel like you can talk to someone who understands what you're going through, and they don't have to be other parents. Everyone can help with parenting.
So we asked ourselves, how can we support parents? And the answer was ParentWise. We created ParentWise to meet parents where they are, learn more about what they go through as parents, and equip them with parenting tips based on research done locally and abroad. We also wanted to connect parents to a supportive community, both physically and online. So we created Wise Journeys to facilitate group learning and hold meaningful conversations with parents to learn from one another's experiences. I guess it's really like the saying, it takes a village to raise a child. Only with realized, it takes a village to raise a parent as well.
Welcome back, Alex. We also welcome Associate Professor Mary Daniel. She heads the Department of Child Development at KKH. Alex, besides nutrition, the parental child experience is also important in the first 1,000 days. What has been our healthcare's response to evidence on the first 1,000 days?
Thank you, Mr. Magnus. KK takes this evidence very seriously. In fact, we generated some of it ourselves through research as we work towards translating it to benefit our children and their families. We have sought to strengthen early childhood development in Singapore so that children can be screened, identified, and provided holistic support as early as possible. And as alluded to earlier, we have established the Human Milk Bank with the help of the Temasek Foundation so that infants can receive the best possible nutrition, which is important in growth and development. We have also worked very closely with our partners to put in place community-based integrated systems of care for the vulnerable families, mothers, and children. An example is Kids Integrated Development Service, or Kids 0 to 3. And our staff have also been involved in the development of Kids Start to help children 0 to 6 years of age. We are piloting a program to create a learning ecosystem that boosts community and able readiness for the first 1,000 days of a child's life.
Thank you, Alex. Mary, as you know, the first 1,000 days is the most important, but it is also the most challenging for many parents. How can they benefit from ParentWise?
Parents with infants and toddlers can join a ParentWise learning group because they can get to lean on each other, other parents. The learning groups are unique because they involve parents, they involve caregivers in mutual sharing. And parents can also join in as facilitators to guide these learning sessions and share parenting tips.
Indeed, nothing is better than a group of supportive parents, right? But how can one reach out and support fellow parents?
Parenthood is rewarding. It is funny, and it's definitely messy. So ParentWise wants to capture all of these varied aspects of parenthood. We invite the parents in our audience to contribute stories, episodes, anecdotes about their parenting up and downs. And by sharing, all of us will learn together. And this is what ParentWise is about.
Mary, what about parents of children with special needs?
Every child is important. And parents of special needs are very, very welcome to join in these sessions. There are many tips, many strategies that they will find useful. And frankly, I think that their stories will actually encourage many other parents.
Thank you, Mary. I really wish there was a ParentWise in my day. There is never a dull moment when you are a parent. And I'm sure many in our audience already have stories forming in their heads. With this, I would like to thank Alex, Chien, and Mary for curating these calls to action with the Temasek Foundation. They will certainly make a positive impact on our community.